Okay, so let's talk about some respiratory diseases. One respiratory disease that you have probably heard of is asthma. And asthma is related to allergies. So it is usually an allergen of some form, but it can be just cold air. I know some people get asthma attacks when they um, are exercising, but generally you have an allergen. And so this triggers the contraction of the bronchioles. So the bronchioles are small vessels that have smooth muscle. And so they constrict. And so that makes the person feel like they can't get enough oxygen into their lungs when they're breathing. So this generally leads to a dry wheezing. So it generally is not related to mucus production. It's actually constriction of the bronchioles. So when they take an inhaler, that inhaler is a bronchial dilator. So it causes the dilation of the bronchioles so that they can breathe more freely. Now, this is different than bronchitis. So this is inflammation. And this could be due to a bacteria or a virus. And this causes mucus production. So instead of a non-productive cough, when you cough and you have bronchitis, you're coughing up mucus. This also causes constriction, it makes it harder for you to breathe. And so with bronchitis, you would treat that if it's bacterial with an antibiotic. Now, we did talk about emphysema. So this is actually where you have damage to the alveoli. And this could be due to cigarette smoke, but it could also be due to industrial pollution. It could also be due to inhaling particles into your lungs. So like if you're a coal miner or you work where there's asbestos fibers, for example, that could lead to emphysema. Now, bronchitis and emphysema together sometimes produce what is called COPD. So this is chronic obstructive pulmonary disease. So chronic obstructive pulmonary disease. So this is a chronic disease. It's not something that can, if the damage has been done in the lungs, oftentimes it's permanent. And so people have to be put on oxygen or maybe even ventilated if they have really bad COPD. So if we look at a diagram of this COPD, here you can see that with healthy bronchi, you might have a little bit of mucus, but with chronic bronchitis, then you get constriction of the air pathways and the production of mucus. And then emphysema is where the alveoli start to break down and there's less surface area and they also thicken. So they're just not getting enough oxygen. And so the reason why you would go on to oxygen is that if you increase the concentration of oxygen that you're breathing in, there's going to be more diffusion. So it helps to make up for the fact that there's not as much surface area over which you can get oxygen. So diffusion occurs more readily if you take oxygen supplementary. And then if the lungs, if you're still not getting oxygen, maybe you would need to go on a ventilator to push oxygen into the lungs in order for you to breathe. You could also, in the case of not being able to breathe because of constriction of the back of your throat, you could have a tracheotomy where you open up and you can breathe right into the trachea. So you bypass all of the other structures so that you can more readily get air into your lungs.